my dear students, for this. Uh, I, I, I welcome you all for today's session. So, uh, shall I start now? Okay, I think it's time up.
Yes, sir.
Uh, I will start now. If there is any anything is there to ask and all, we'll end of the discussion, end of the presentation, we'll discuss. Uh, Now I will going to share my PPT. Is it visible to you? Uh, Hello, Krishna Raga sir.
Yes,
Is
sir.
it screen is
Yes,
sharing? Uh, I'm
the
sharing my
screen is not.
screen.
Yes, sir.
Okay,
Yes, sir. Please share, sir.
I shared screen. Wait, is it visible?
Yes, sir. Screen is visible.
Visible. Okay, fine.
Yes, sir.
Once again, welcome you all for today's exam-oriented class on this KOUMARABHRUTYA topic. So, without wasting much time, we will start our session. So, content of today's topic is for understanding the CBDC syllabus, that is the must to know, desire to know, and nice to know questions and syllabus points that we'll discuss, and understand the question paper patterns and structuring the answers we'll discuss today. And Kaumarabhritya is a theory examination. You all know that it is a 100 marks question. Paper will be there, maximum 100 marks will be there, and in that they will ask multiple choice question 20, and SAQs 8 will be there, short answer questions, and long answer questions will be 4 questions will be there. So you all know this, and total it's a 100 marks questions will be there on this. So it's a all questions are compulsory, and time is given for this is the 3 hours. Next is the MKDK, nice to know, must to know, desire to know, and nice to know topic of syllabus point. In that, the MCQs, majority, the almost 15 questions they will ask from the must to know part of syllabus. So almost out of 20 MCQ questions, 15 questions will be from the must to know part of syllabus point, and maximum 3 questions will be asked from the desire to know part of syllabus points that we'll discuss, and questions from the nice to know part is the maximum 2 questions. So you have to concentrate more on must know part of syllabus rather than desire to know and nice to know part. So SAQs, in that, the out of 8 questions, 7 questions will be on the must know part of syllabus, and desire to know maximum may ask 1 question, or they may not ask also. So here also must know part of syllabus is very very important, and LAQ, that is the long answer questions. In that, so everything, the all the questions will be you have to draw from the exclusively from the must know part of syllabus. So they won't ask a desire to know and nice to know part of syllabus point. They will not ask from that point. So mainly they will ask from the must know part of syllabus. This I think you all know this. So next slide. This slide is about the distribution of theory examination. This is the blueprint about the from which topic, how much the marks is allotted marks on different syllabus topics are guided in this F6 distribution of theory examination, that is the Kaumarabhrutya topic. In that, the mass distribution are explained. So, there are six syllabus points are there in this. In that, long essay questions are there are four long essay questions will be there. Six syllabus points, that is the Navajata Shishu Paricharya and Stanya Vijnana and Swasa and Swasana Rogas and Mahasrotas Rogas and Rasarakta Rogas and Tok Rogas and Attaika Chikitsa. In those syllabus points, they will take the long answer questions they will draw from these points. That one by one we'll discuss in detail. And SAQ questions, almost all the syllabus points they have mentioned except for Introduction to Kaumarabhrutya, Kishora Swastha, last one, 21 and 22, Anya Rogas. In those points, only the SAQ questions are not taken from these syllabus points, but remaining all they have mentioned. But in this, except from the six syllabus points, we have to other syllabus points which are explained for SAQ questions, we have to concentrate on these topics that also we'll discuss. Okay. So next is the what is it tips and guidelines for while writing the exams. So first you need to read the questions carefully and understand what it is asked. That is very, very important because you should not get confused with some of the questions and all. You should Hai Putana, Kukunaka and all in these questions, they will get confused with this, whether it is eye disorder, whether it is Gudagata Vikara and all. You should not get confused. First, you have to read carefully the questions and understand what it is asked and plan your time according to the marks allotted. So because you have to see the 10 marks, how much time is there, how much time you have to give, and for the 10 marks and all, you have to divide and you have to your time management is very, very important with respect to examination. And answer all the questions. You should don't avoid any questions or don't leave the any questions. If we know modern aspect of that point, you write. Otherwise, if you know Ayurvedic, if you don't know modern, at least you write something related to that topic. You should write. Don't leave the questions blank. That is the very, very important thing. And write the answers with a proper headings and subheadings. This will going to highlight means examiner, the who is evaluating, if you will see whether they know the topic or not. So they will not read the all the lengthy explanation and all. So proper headings and subheadings are very, very important, and you have to focus on key points rather than unnecessary lengthy explanations. So use wherever the flow charts, tables, diagrams, wherever it is necessary, you write it. And a very, very important thing is whenever they ask some of the Ayurvedic related questions and all, you need to write slokas. If you don't know the sloka, at least you can write the Sanskrit words of that particular sloka and all. You should write wherever it is asked or whenever it is asked related to the Ayurvedic points, you should write and underline the key important keywords. For example, if they ask any of the diseases, you have to write a cardinal feature of that diseases. You should highlight those points. Important points has to be highlighted or underlined for while writing the examination. And whenever they ask case based questions are there, you have to write the what they have asked. Usually they will ask structured questions like etiology, clinical features, diagnosis and management of the any of the disease they may ask, atisara, swasa and all. Systematically you have to write all these points, and by that you will get a good scoring and all. Okay, unnecessarily don't write only clinical features very lengthily. We should not write. You have to make whatever the asked questions are there. Etiology, if they ask all these structured questions, etiology, different clinical features and all, like that you have to systematically you have to write all the highlight. You have to do it, and all the you have to cover all the points. So keep the presentation neat, clear, and well organized, and be precise, systematic, and clinically oriented in your answer. It should be. practically oriented should be there. You should not write any unnecessary things. You should not write. So now we'll move on to the syllabus-wise distribution and marks distribution and all. We'll discuss one by one. First is the first syllabus point, that is the introduction to KOUMARABHRUTYA. In that, they have given only MCQ question. So only we have to draw, they may ask only MCQ questions on it. There is no any LAQ questions or SAQ questions on this topic. Only they will ask is the MCQ question is the only one they will ask. So in this mainly they may ask in the definition related, they may ask or scope or importance they may ask, and mainly they may ask in classification of age is very very important. So Ayurveda, in that they may ask questions on the MCQ questions, they may frame on this. Some of the examples for this MCQ questions, that is the age classification as per Kashyapa Samhita, they may ask. So you all know that Garbha is included under the age classification as per Kashyapa Samhita. So somebody will get confused with this, whether Garbha, how it comes from the age classification. That's what they may ask these questions. So Garbha, Bala, Kumara, all the above. So if these type of questions are there, you should read very carefully and you have to take the relevant answers. That is the in this question, first question, the all the above is the answer, because the Garbha is also included under the age classification. Garbha, Bala, Kumara, Kamiti, Trividam Moyaha anta ಹೇಳ್ತಾರೆ ಕಶ್ಯಪ ಸಂಹಿತೆಯಲ್ಲಿ. So that explanation you should know, that is the Garbha is also included under the age classification. So next they may ask which of the following is included under the Kaumarabhrutya. So you know that okay, Garbhini Paricharya is also included under the कौमारभृत्य गर्भोपक्रम विज्ञानं सूतिकोपक्रमं स्तः बालानां रोगनक्षमनीक्रियाः बालचिकित्सितं. So Garbha, this Garbhini Paricharya, Sutika Paricharya, and the diseases and treatment related to the Bala Chikitsa is also included under Kaumarabhrutya. So you should not get confused. Garbhini Paricharya won't come under this. So they may ask like these questions. All the above is the answer for second question. And the scope of Kaumarabhrutya including growth and development, nutrition, and childhood diseases. So all the above is the answer. So it is also scope of Kamavritta is the overall growth and development. It also covers the nutritional aspect and childhood diseases also it will cover. So all the above is the one of the answer. So one more age classification in the children is important in understanding the growth and development. Okay, it won't covers only the height, weight, and all. So overall growth and development of the child, the age classification is very very important with respect to growth and development. That you have to answer it properly. So even they may ask age-related questions like Kshirannada. What is the age group of Kshirannada or Kshirada? So Kshirannada is the 1 to 2 years is the Kshirannada. You all know that. So they may ask Kshiradavastha, that is the 1 year is the Kshiradavastha, Kshirannada is the 1 to 2 years. So wherever they ask related to these type of questions, age classification, what is the Pauganda, 5 to 10 years is called as Pauganda. So those things you have to highlight this. And perinatal period. So perinatal period, they may ask perinatal period also. This is also one of the favorite topic they may ask. That is the 28 weeks of gestation to 1 week till the 1 week after the birth is called as perinatal period. So this also you should remember. And toddler is the 3 years age. Preschool, school age and all you will be knowing pivotal age and all. So you may ask the preschool this toddler age. Toddler age is the 3 years. Up to 3 years is called as toddler. Neonate is the up to one month or 28 days is the neonate. Infant is the up to 1 year is the infant. Later on, toddler will come. That is the 1 to 3 years is called as toddler age group. So, like this, they may frame MCQ question. Any one they may ask in this topic. That is the syllabus number 1. So, next is the syllabus number 2. That is the Bala Samvardhana. That is the growth and development topic. So in that, there are 7 marks they will ask in this. Mainly, they will ask the one question will be on SAQ. That is the short answer questions they will ask, and two questions will be on MCQ. So there are three topics are covered under this Bala Samvardhana Vikara. Bala Samvardhana. In this topic, there are three topics are dealt. That is the one is growth and development related. Second one is the childhood samskara, and the third one is the Danta Vijnana. These topics are dealt under this Bala Samvardhana syllabus topic. So this childhood samskara is if you see the nice to know the if you see the syllabus, this is childhood samskara is classified under nice to know syllabus point. So they won't ask questions, SAQ questions on this. So they may ask one question may draw from MCQ question may draw from the childhood samskara. So remaining the one question, it will come from the either growth and development or in the Danta Vijnana topic. So Danta Vijnana topic or the growth and development topic. So you should concentrate on these syllabus topic rather than childhood samskara, because childhood samskara is classified under the nice to know syllabus part. So there only MCQs they will ask on those topics. So SAQs questions on these topic they may ask is the Danta Udbeda Janya Vadis. This is very commonly asked questions. Practically also we'll see the patient with a Dant Udbeda during the dentition. Child may present with a Swasa, Kasa, Atisara and all very common features will be presenting for the child. So this is the seen practically also clinically we'll be seeing these cases and its management and all. We have to write in detail about this topic. So they may ask essay and previous question paper. If you refer, Dantu Udbedajanya is also one of the favorite topic. They have asked previous years and all. They have asked its management and Dantu Udbedajanya Vadis. So and some questions they may ask in the topic say define development and enlist the normal developmental milestone in gross motor. So gross motor many a times in the previous question paper if you refer, they have asked the gross motor milestones. So you all know that development is a qualitative change in the qualitative change or a maturation of function with the age is called as development, and growth is the it's a physical change. Okay, that is a physical change as the age progresses. Physical maturation will be taking place. That is the growth. So factors affecting the growth and development also they may ask, and assessment of the growth parameters. So assessment of the growth parameters is by anthropometric measures, that is the height, weight, head circumference, and chest circumference, and the mid upper arm circumference and all. By that we'll be assessing the growth of the child. So development, how we will be assessing that development will be assessed by the some of the screening charts are there. By seeing the developmental milestone one and other assessment, development will be assessed by the Dasi scale or Denver developmental scale or Trivandrum developmental scale. So that is also the assessment scale. On that also they may ask, you should know about that. Okay. So one, they may ask question on the Dantudbedajanya Vadis or related to the growth and development. You should MCQ one SAQ question will come on this. So one MCQ question will come on this the samskara topic. You should read that also. The very favorite samskaras will be the Karana Vedana Samskara, Upaveshana and Annaprashana. Even they may ask Jata Karma also. These are all the common samskaras. Previously also they have asked many a times, and these are the some of the explanation will be more will be getting on these samskaras. So they may draw some MCQ questions on this topic. One question will be they may draw on these topics and all. You should read this thing. And other one question, MCQ question may they may draw from any of these eye yielding revision points you should know. So how birth weight when it doubles and all. Okay, what is the growth, what is the development and all. They may frame on these MCQs. They may frame on this or birth weight when it doubles. So birth weight it will be doubled at fifth month, triple at 1 year, and 4 times at the 2 years and all. What is the average birth weight, average length, birth length and all? They may ask, and about the head circumference, the social smile, neck holding, and bisyllables, that is the mama, dada, and all. When they ask, that is in the ninth month and all. Like that, they may ask, or sitting without support, walking without support in the 12 months, sitting without support in the 8th month. Like they may frame MCQ questions on these topics. So, as per the modern tooth erupts at the age of 6 months. So, as per the Kashyapa Samhita, tooth, normal tooth in the children, that is the Danta Sampat, that is the normal tooth eruption should be taken place in the 8th month as per Ayurveda. But as per modern concept, that is the usually between the 6 to 9 months. The first tooth will be erupt from the 6th month. That is the as per modern topic. So when anterior fontanelle closes, that is the 12 to 18 months is the answer. And how this the development will be followed, how development will be followed, that is the in the cephalocaudal direction and proximo-distal direction. So this question also they may ask in the MCQ. So growth hormone is secreted by which endocrine gland, that is the anterior pituitary gland. So these are all the high yielding university revision points you should go through in the with respect to MCQ 1. Okay, 1 marks of the MCQ. Okay. So next is the some of the MCQs I have mentioned here, like birth weight usually triples by. Okay, that is triples by the 1 year. That is a C is the answer. And a child usually says mama dada. That is the bisyllables by the at the age of 9 months, and that is the B is the answer. And the child usually knows his gender by own by knows his or her own gender at the age of 3 years. Baby will be knowing uh, our gender, our baby gender will be knowing at the age of 3 years. So like that, they may ask questions. During the first year of life, infant may gain how much height, they will ask. So directly they won't ask what is the height of the 1 year old. So they may ask, you should not write 1 year, first year of life. During the first year of life, an infant gains approximately, and they ask this question. So you should not write 75 centimeter is the length of the 1 year child. So at birth, it will be 50 centimeter. So at 1 year, it will be 75. So around 25 centimeter gain will be there in the first year. So that you have to write 25 centimeter. You should not write 75 directly. Okay. How much gain they have asked. So you should not get confused with these type of questions. So they may ask the development proceeds which direction, that is the cephalocaudal direction, and proximo-distal direction, it will be there. So that you should like that they may ask questions, MCQ questions on this topic. So third syllabus point, that is the Navajata Shishu Vijnana. So Navajata Shishu Vijnana, in that the 11 marks are the distributed marks on this syllabus point. That is the MCQ. They may ask MCQ, SAQ, or LAQ questions on this topic. But most of the time, if you see the previous question paper, and this is one of the favorite topic for the LAQ questions, that is the long answered questions they will ask on this. So one question definitely it will be, I think 100% they may ask one questions, LAQ questions from this topic. That is the favorite one is the Navajata Shishu Paricharya they may ask, or related to the Prana Pratyagamana they may ask. So Garbharuddhi and Vikasa and Ayur Pariksha Vidhi, that is assessment of longevity, Lakshana Adhyaya, which is explained in the Kashyapa Samhita. Those topics are classified under nice to know topic. So they don't ask questions on those topics. So remaining all are the must know part. So they will ask one question, that is the commonly asked questions is the long questions on this Navajata Shishu Paricharya is the explain Navajata Shishu Paricharya including Prana Pratyagamana in detail they will ask. or they may ask explain the steps of prana pratyagamana with advances in the recent advances in the NRP, that is the neonatal resuscitation program, they may ask, or examine the newborn baby and assess the gestational age. So in this examine the newborn baby and assess the gestational age, you have to write the what is the vitals, how is the head to toe examination in detail you need to write, and assessment of gestational age by one is physical structures of the baby, and second thing is the Ballard neuromuscular scoring. So based on that, we'll be assessing the gestational age in the newborn baby. So those things you should highlight. And one more they may ask is the questions on this topic is the define and enumerate the birth injuries and analyze their causes and all. They may ask and describe the clinical features and management of caput succedaneum and cephalohematoma. So, you know that the birth injury is any physical impairment or a damage or a structural injury sustained by the newborn baby during the delivery process. That is the birth injury. So, what are the enumerate the birth injuries? So, what are the birth injuries? Common birth injuries is the one is soft tissue and head injuries. So, soft tissue head injuries in that the caput succedaneum, cephalohematoma, and subconjunctival hemorrhage will come, and nerve damage and paralysis in that brachial plexus injuries like Erb's palsy or facial paralysis. So in these will come under the birth injuries, and brain related. If there is a injury, birth asphyxia related injury, that is the HIE changes, hypoxic ischemic encephalopathy or intracranial hemorrhages and cerebral palsy. So all these comes under the brain and oxygen related. So soft tissue injuries are different, and nerve related damages are different, and related to the hypoxic changes, that is also the different topics are there in this. And what may be the causes for this is the in this topic is the injuries, that is the fetal macrosomia. If baby is very big because of diabetic mother and all, if there is a diabetic mother is the gestational diabetes, if it is diagnosed, then macrosomia, baby weight will be more. Because of that, CPD will be there, pelvic disproportion will be there. Because of that, injuries may take place in the instrumental deliveries, and there may be a vacuum delivery may take place because of the big baby and all. So in these cases, there is a chances of injuries. So next, one more question is the explain the care of preterm and post-term baby, they may ask. These are the LAQ questions on Navajata Shishu Paricharya. Mainly, they may draw from the Navajata Shishu Paricharya topic. So you all know that Navajata Shishu Paricharya, in that there are 10 procedures are explained by different acharyas, that is the Mukovishodhana, Nabhinalachedana, Garbhoda Komana, Pichudharana, Jata Karma, and Swaranamrata Prashana, Raksha Karma, Ulva Parimarjana, and Abhenga and Snana are the 10 Navajata Shishu Paricharya explained by the different acharyas. And also, they may draw some of the questions from the Prana Pratyagamana. Also, there is a chances. You all know that the what are the steps? 5 steps are explained by the Ayurveda acharyas related to the Prana Pratyagamana. That is the Asmano Sangatanam, Karnayor Mule, Shitudekena, Ushnudekena, Va Mukha Parishekaha, and Krishna Kapalika Surpena, Abhinishpuniyat. So these are all the very, very important topics that they may ask. That is the Asmano Sangatana, Shita Udekena, that is sprinkling of the cold and hot water, and fanning by the broken earthen pot, and pitch dharana by the Balataila at the anterior fontanelle, you have to do it, and mantra ucharana. Last one is the Daiva Ipashraya Chikitsa, that is the mantra ucharana is also explained by in this Prana Pratyagamana topic. So you have to write in detail about these topics as per Ayurveda. If they ask recent advances in NRP and all, or if you know the NRP procedures, that is the initial steps of resection, that is the PSSR. If it is failed, you have to do the PPV. If it is failed, PPV is even PPV is indication for PPV is the whenever it is a failure of initial steps of resuscitation, that is the PSSR. Okay, positioning, suctioning, stimulation, and repositioning. So all these things, all these flow chart steps you should see, and you should write this flow chart if they ask. If in detail, if you are not able to present with NRP, you can write a flow chart. By using this flow chart, you can write. So common steps, 10 steps of resuscitation, that is the being prepared for resuscitation, prevention of heat loss, and position of the baby, and suctioning of the airway, tactile stimulation, free flow auto administration, bag and mask ventilation, chest compression, and endotracheal intubation and medications are the main 10 steps are included under this the neonatal resuscitation. Okay, this is about the syllabus number third. So syllabus number fourth, that is the Stanya Vijnana and Bala Poshana and Vadik Chamakva. In these two syllabus points, they have distributed 11 marks. So 11 marks we have to draw from this topic. So usually this is all from the must know part of syllabus are there in these both the syllabus points. So you have to read the Stanya Vijnana is very, very important topic. Many a times they have asked the LAQ questions on this. So commonly they will ask LAQ questions on this Stanya topic, and one more is the Navajata Shishu Paricharya. So LAQ questions on these topics is the define Stanya and explain the process of Stanya Utpatti. So physiology of lactation, enlist the Stanya Guna and Suddha Stanya Lakshanas, and all you have to write. Wherever here you need to write the wherever sloka is there, sloka, if you know the sloka and all, you have to write here. So rasa prasado madaraha aharaha pakwa ara nimityaje and all. So how stanya utpatti will take place, and what is the importance of stanya, that is the matareva pibestanyam tatparam deha rudde. Those slokas, very, very important slokas, they will ask. So, and gunas in that narastu Madhuram Stanyam Kashayam Anuguram Imam. That is the Anurasam Imam. That is the these gunas also you have to write sloka, and Stanya Lakshana, Suddha Stanya Lakshana. In the Kashyap Samhita, he has explained very beautifully about the Stanya Lakshana. That also you have to write. That is the Avyata Balangana Mayira Rogo Vardate Sukam Shishu Datraya Anapattihi Suddha Kshirasya Lakshanam. So this the sloka you need to write in this Suddha Stanya Lakshana, and Stanya Pariksha they may ask, and explain the advantages of breastfeeding and write the note on rank practices of breastfeeding. You have to write advantages related to the baby, advantages related to the family, advantages related to the mother. You need to classify, and you need to write in this advantages only to the baby. You should not write what is the benefit for the mother, so what is the benefit for the family and society. So that you think you all know that okay, it reduces the economy of the this thing, economic burden to the family and all. So what are the important points are there, one or two points, if you know that, you have to classify and you have to write it in a different subheadings. So wrong practices of breastfeeding also you should write. You should not give anything. Exclusive breastfeeding should be given till the 6 month and all. You should not give any of the other top feeds. You should not give and all. You have to write. So identify the what are the complementary feeding in the absence of breastfeeding. Also you have to write. Main is the Datri. So if it is mother is not there, Datri is appointed, or other than that, you have to Payachagam. You all know that. Okay. Gavyam va Payachagam. So processed with a Trina Panchamula. That is the we have to give this classically they have explained. You have to highlight on that topic on this. So explain the Nidana Beda Lakshana of Chikitsa Stanya Dushti. There are Astakshira doshas are there. Those things you have to write in this topic. Okay. So you all know that what are the Astakshira doshas. Vairasya Pena Sangata, Roksham Chanilatmake, Pitta Vaivarinam Daurgandham, Sneha Paichilla Gauravam. So these 8 dushtis are that should be explained in this topic. And other questions they may ask is the enlist the diseases due to Stanya Dushti and explain the Nidana Samprapti Lakshana of Kshiralasaka. Commonly, Kshiralasaka also is, if you see the old question papers and all, Kshiralasaka is also one of the favorite questions they have asked. So, what are the enlisted the diseases related to the Stanya Dushti is the Aiputana, Kshiralasaka, and Kukunaka, Parigarbika, that is the Kshiraja Roga. So these are all comes under this Stanya Dushti Vikaras related to the children. All these topics will come. So that you have to highlight those, you have to enlist that you have to write all those names and what is asked, which one is asked in detail, that we have to write in this topic. So, and even in this second topic, that is the if Bala Poshan and Vedic Shamatwa topic, in that they may ask some questions on the RCHO program. What is the RCHO program, and what are its objectives of the RCHO program and all you need to write. So, and they may ask later the national immunization schedule or Kumara Shosha in detail. So these are all these some LAQ questions are commonly asked in this topic. So this is a slide. This is showing about the breastfeeding, different breastfeeding positions, and what is the latching and all, how it is a normal latching in the newborn baby during the feeding and all. This slide is showing. Just go through this. And immunization schedule. So national immunization schedule or a universal immunization schedule. This slide is covering about the immunization schedule at birth. The BCG, hepatitis B and OPV is given. That is the dose is 0.1 ml. In this slide, 0.5 ml is there. So 0.1 ml is the intradermal. We have to give what is the route, what is the site of the administration and all. In this slide it is given. Just go through this slide about the immunization schedule. They will ask this question. Commonly they will ask, this is also previously many a times, many question papers they have asked this questions. So maximum questions are drawn from the what are the important points are there, and the previous question papers also what they have asked. So importance was given for those things, and those are the important topic only they will ask in the questions in the examination done they will ask. So RCH program, when it is started, there is a 97, 98, and mainly to improve the health status of the women and child care and all, you have to write. So it is operate under the NHM program, National Health Mission. Under this it will operate, and mainly to reduce the maternal and under 5 child mortality rate. This RCH program was started, and many of the programs related to the nutrition, related to the infection prevention and all, they have started this question, the RCH program. So in detail, you need to write if they ask any questions on those topic. That is the RCH program. And next syllabus point is the Kuposhana Rogas and Bala Pariksha Vidhi and Chikitsa Siddhanta in children. So in these two topics, the 7 marks are allotted for these two topics. So they will ask SAQ questions on this topic. There is one SAQ questions will be there and two MCQ questions will be there on this topic. So very favorite question is the Pakkaroga or severe acute malnutrition. That is the severe acute malnutrition. In under that, there are two important will come. That is the marasmus and kwashiorkor. That will come under this severe acute malnutrition. In that, you have to write whenever they ask about the severe acute malnutrition. You have to write about the marasmus and kwashiorkor topic. You have to write, and failure to thrive and all. They have syllabus points are there. So we'll see the what are the common questions, SAQ questions they may ask related to this is the define malnutrition and classify the undernutrition according to WHO, and describe the clinical features and management of the severe acute malnutrition or a moderate acute malnutrition they may ask. And second question they may ask on this topic is the define Fakkaroga. So this is very beautifully explained in the Kashyap Samhita about the Fakkaroga, Balaha Samvatsara Paraha Padabhyo Nagachati. So even after 1 year of age group, child is not able to walk. So this is the we have to write the definition and what are the Veda, what is the causes for this, and what are the types, that is the Kshiraja Pakka, the Garbhaja Pakka, Vyadisha Pakka, and all you have to write, and what is the Chikitsa of Pakka Roga and all you need to write in detail about this topic and explain the and one more question they may ask is the explain the general treatment principles in children and explain the different methods of drug doses determination in the pediatric population. So drug doses, I think they may not ask STQ questions on drug doses. They will ask MCQ questions on this topic. So they will ask mainly the Fakkaroga they may ask are related to the malnutrition. And one more topic is the general treatment principles in children. 5 marks question they may ask in these topics. So usually different methods of drug doses and all they will ask MCQ questions on this topic. So you all know that these topics, that is the malnutrition disorders, that is the marasmus and kwashiorkor. So these are this slide is showing about the what are the clinical features of different the malnutrition conditions, that is the severe acute malnutrition conditions, that is marasmus and kwashiorkor. In this, flag sign is important in related to the kwashiorkor, and flecky paints are dry feeling skin, that is the flecky paint is the important sign in this, and edema is a very important. Pitting edema is one of the diagnostic feature of this kwashiorkor, that is it is mainly because of protein deficiency. And marasmus, in that usually monkey's faces will be there, and muscle wasting is a very important sign in this. So you have to you have to highlight the what is important, it is there, you have to highlight it and you have to write related to these topics. And how to manage the severe acute malnutrition is explained in this slide. There are 10 steps are there to treat this acute severe acute malnutrition. So first you have to manage the 1 to 2 days. You have to manage with hypoglycemia, hypothermia, dehydration, and all. You should not get directly. You have to supplementation. You should not give to the. This is what is the importance of this slide is whenever we ask about the questions related to the malnutrition. So many of the students they will write the directly the you have to give a protein this much, the energy this much, you have to give a well nourished food and all they will write. So whenever we ask questions related to the severe acute malnutrition related, you have to step by step, there are 10 steps are there to manage this condition, severe acute malnutrition. So in Ayurveda also directly we will not treat the directly will not give this supplements to the child who is malnourished. First we have to treat the Agni. So Agni Mandya we have to treat first, then we have to give the Brahmana line of treatment. So in the same way here also they have classified different things they have classified. That is the hypothermia you have to manage for 1 to 2 days. Hypoglycemia, hypothermia, dehydration has to be managed. So then later on we have to start with the electrolytes. Yeah, we have to control the infection initially, and micronutrients, the iron and all first initial days they won't give. So all these topics are very steps are very important in managing the malnutrition in children. So you should know this. And Bala Samanya Chikitsa Sutra, you should go through this. That is Nivritti Romanadi Nam Murditvam Paratantrataha Vakcheshtayor Asamartyam Vikshe Baleshu Shastravid. So Beshajam Salpa Matram Cha Yatha Vyadim Prayojayet. So in these, whenever they ask related to this, you write relevant slokas. Madrani Kashayani Kshiravati Mridunicha. So all the drugs, whatever we are giving, that should be palatable and that should be Madura in nature, Kashaya in nature. And you should not give Atyartham, Atisnigdam, Atiruksha Dravyas and Ati Amla Dravyas, Katu Vipaki Dravyas should not be given for the children. So all these are very, very important while writing the Samanya Chikitsa Siddhanta in children. So related to these the Aushadha Matra, they may draw some of the MCQ questions on this topic. That is the Vidangafana Matram tu Jata Matrasya Deyenaha Veshajam Madhu Sarpibhyam Matiman Anukalpayet. So these the Vardhamanasya, that is the what is the how much should be the dose should be given for the Shishu, and till the 1 year they have explained in this Kashyapa Samhita. So they may ask what is the dose for Jata Matra athva newborn baby, they may ask. So you should know the it's equal to the 1 Vidanga is the quantity which is explained in for the newborn baby. Vidangafala matra is the for the newborn baby. In Viva also many a times we will ask this question related to the matra of the matra related to the children. So this is the at 1 year it will be one Namalaka matra will be there. So you should know they may ask MCQ questions on these topic, that is a dose of the Gruta or the Churna and all. They may draw the some of the questions, MCQ questions on these topic. Okay. So next syllabus point is the Kulaja and Sahaja Rogas. So Kulaja and Sahaja Rogas, in that the 5 marks are allotted for this syllabus point. In that the Sahaja Vikaras, that is the congenital anomalies, in that they have classified it under DK. That is a desire to know topic they have classified, desire to know. So they may ask one questions on this desire to know topic, that is the SAQ questions. Mostly they may ask on the Kulaja Vikaras or muscular dystrophies, that is the chromosome related disorders, they may ask in this topic, because so related to the these SAQ questions, Kulaja and Sahaja Rokas related questions they may ask in this syllabus topic is the describe the clinical presentation of spinal dysmorphism, that is the and its management. Spinal dysmorphism is the spina bifida. So closed neurotubular defect, open neurotubular defect, that is the meningocele, meningomyelocele and all, it will come under this. But this is classified under a desire to know topic. So one question may arise from the desire to know topic, that they may ask in this, they may select this topic for the, because spina bifida is also very commonly asked in previous question papers. So this is one of the topic they may choose. So that's what I have mentioned, this spinal bifida, that is the even desire to know topic also in the SAQ questions. So remaining the very commonly asked question is the Down syndrome or Turner syndrome. That is, they identify the chromosomal abnormality, clinical features, diagnosis, and risk factors, and plan the management in case of Down syndrome or a Turner syndrome. They may ask this type of questions on this syllabus topic. So you know this is Down syndrome 21, the 21 trisomy, and Turner syndrome 45XO and all, you know this topic. And they may ask one more important thing is the describe the etiopathogenesis and clinical features and management of the DMD, that is the Duchenne's muscular dystrophy also they may ask. So this is a slide showing related to the types of spina bifida, that is the meningocele, meningomyelocele and all, and other abnormalities related to the neural tube defects are there in this, but this is classified under the DK. This is also classified under, that is congenital heart diseases, that is cyanotic, acyanotic, and other things are explained in this, but they may not draw the questions on this topic. And this very, very important thing is the Duchenne's muscular dystrophy. So this is the must to know part of syllabus. They may ask questions on this, and Gower sign. This is the very, very important sign we'll be asking in the examination. This is related to the genetic problem. So what are the common features are related to this topic? This condition is the muscle weakness will be there, developmental delay will be there, child will be difficulty in climbing stairs. First 3 years baby will be stable. Whenever baby will start walking, so that time child will be, the presentation will be seen in this case. There is a difficulty in climbing and frequent falling while walking and all may take place. And that is the calf muscles, hypertrophy of calf muscles and all, it will be there in this topic. And child usually end up in death in the second decade. Second decade only. There is a most chances of death will take place in the second decade in this case. So this is a Duchenne's muscular dystrophy, and we'll be asking about the Gowers sign. This is a, because of muscle weakness, child is unable to get up directly. It will take the support of knee, thighs, like it climbing the something that, like that child will be standing up. That is the very important sign related to the Duchenne's muscular dystrophy. That is the Gower sign. We'll be asked these things in the YY and all these signs. So Turner syndrome and Down syndrome, you all know this, so no need to discuss. There are many other syllabus points are there. Okay, so in the Graha Roga and Upasargika Roga, there is the infectious disorders. In that, they will ask one MCQ question on this, and one SAQ question on this, and three MCQ questions they will ask on this syllabus topic. So very commonly asked questions are the Graha in that they will ask related to the chicken pox, measles, and mumps. So Karnamoola Shota or mumps, they will ask, frequently asked is the mumps, chicken pox are the commonly asked. Sometimes they may ask related to the measles also. So one question, SAQ questions, they may draw from this topic, or they may sometimes they will also ask related to the dengue fever and typhoid fever are commonly asked some of the questions in this. And very important thing is the Krimi Rogas. So explain the Nidana Lakshana, Samprapti, Beda, and Chikitsa of Krimi, frequently asked question. And related to the common grahas that is classified under desire to know syllabus point, they may not ask SAQ question on this. They may ask some of the MCQs on this. So Krimi Roga is the very favorite question on this topic, or they may ask chicken pox or a mumps or a dengue fever. So these things you concentrate on these topics. So measles, clinical features and all causative factors, you all know this. Measles is the paramyxovirus, and coryza symptoms will be there, and Koplik spot is the very important sign related to the measles. And chicken pox, it is a varicella zoster is the very common causative organism, and the clinical features will be, flea market features will be there. So those things you should go through. And related to the krimi, there are Abhyantara krimi and Baya krimis are there. And Abhyantara, again, it's subdivided into three classifications: Raktaja, Shleshmaja, and Purushaja. In that, there are different names are given. So, Samanya Krimi Lakshana, you have to write frequently asked question. That is the Jwara Vivaranata Shulam, Rudrogam Sadanam Brahmaha, Bhakta Dvesha Atisaracha, Sanjata Krimi Lakshanam. So, Guda Pradesha Kandu is a very important feature in this. Along with that, the Vivaranata. So skin discoloration and pain in the abdomen and all, it is a common features will be there in this Krimi Roga. And treatment protocols related to this is the Apakarshana, Prakriti Vigata, Nidana Parivarjana are the main three line of treatment will be doing it related to this topic. So in this MCQ questions, and Krimi Roga is one of the favorite thing, and other one is the chicken pox and measles, mumps, they or dengue fever they may ask. So next syllabus point is the Swasana Roga, that is the disorders related to the respiratory system, and disorders related to the gastrointestinal disorders. So in this question, there are in this syllabus topic, 10 marks questions they may ask. Very favorite thing is there are two main LAQ questions. If they ask, there are two questions they will definitely they will ask in this is the One is asthma. Asthma is the swasa, tamaka swasa or swasa roga. That is commonly asked question in this. Or tonsillitis. That is the describe etiology, clinical feature, diagnosis, and management of the asthma or pneumonia or tonsillitis. They may ask. Or atisara with the dehydration. This is the very favorite thing they will ask in this. If they ask, because they have to ask four questions. So in that, they will ask two related to the Vyadis. In that, they may ask one question. Selective questions will come from this topic, I think. So you have to read related to the asthma and especially these clinical features related to the Atisara and its treatment and especially management of dehydration and all. They will ask these questions. So related to the swasa, adenoid hypertrophy, tonsillitis, and all very common things they have explained under this. So adenoid is the lymphoid tissue which is present in the posterior part. So same like tonsils. Tonsils will be on the pharyngeal part. So in the throat and all we can able to visible. But in the same way, in the posterior part of the nasal cavity, this adenoid will be present in the picture. It is clearly shown. Okay, Itchation tube block will be there, and ear related problems will be very commonly they encountered. There may be a ear related ear pain may be there, or edema of the middle ear may take place because of this severe infection, that is adenoid hypertrophy. So very common clinical features related to the adenoid hypertrophy is the snoring, and the breathing from the mouth is a very classical feature of this adenoid hypertrophy. Okay, and tonsillitis, you all know this, and asthma. What are the asthma related causes and the symptoms and all highlighted in this? Just go through this, and very important treatment also explained in this slides. Just to go through this, and Ayurvedic treatment related to the asthma is there are Shamana Chikitsa and Shodhana Chikitsa. If it is a Utklesha of dosha is there, directly we can go for the Vamana and administration of Virechana, we can do it. Later on, we can go for the Shamana Ushadis. Okay, Shamana Ushadis, like commonly used Shamana Ushadis in children are the Kantakari, Vasa, Shunti, Barangi, and Pushkaramula, Karkataka Shringi, and Aridra are the commonly used drugs in this. Okay, and next very important thing is the Atisara. So whenever they ask Atisara or Swasa, some points which are there explained in the clinical features which are explained in the Vedana Adhyaya, we need to write. In the Vedana Adhyaya, Atisara Lakshanas are explained by the Kashyap Samhita, that is the Deha Vaivarnya. Okay, there will be a discoloration of the body will be there, and Arati will be there, discomfort will be there for the child, Mukaglani, Anidrata, and all. This the clinical features you need to write, and then common, what is the common related points are there related to the Atisara, you need to write. What is the causes for this Atisara, like Ajirna Boji, Viridhara, or during the dentition, the dental dentition also, the cause for this Atisara. Like this, you have to write the Nidanas and types, that is Vataja Atisara, Pitta Atisara, and all. You have to write the types, and commonly used drugs like Musta, Nagaramota, and Shunti and Pipali. These are all are very important with respect to while treating the Atisara, because these are all the Deepana, these acts as a Deepana and Pachana, and later on if you give a Grahi Chikitsa like Bilva, Kutaja, Dadima, Ativisha. So along with Deepana Pachana, if we give these Grahi drugs, the definitely we can treat this Atisara very well. And commonly used formulations in this is the Musta Churna, Bilva Churna, the Kutajaganavati, or the Balachatrabhadra Rasa. So these are all the commonly used drugs related to the Atisara. You should write in detail about when if they ask about the Atisara LAQ question. If they ask, you have to write in detail about this topic. Okay, and related to the dehydration, you have to know dehydration symptoms or some dehydration symptoms. Your dehydration symptoms are there in this slide. just go through this. I think you all know this. Okay, you have to see for the general condition of the child. You have to see for the eyes, mouth, tongue, and you have to say ask for the is there any more thirst and all, and you have to see for the skin pinch for the skin turgor. We have to see for the hydration. So based on that, we'll classify some dehydration, no dehydration, and severe dehydration. So next slide is related to the treatment of dehydration. It is there explained in this. Okay, the plan A, plan B, and plan C. We have to write in detail about these topics if they ask for the LAQ questions. So next is the Rasa and Rakta Rogas. So 10 marks are allotted for this topic, that is the Rasa and Rakta Rogas and Antarshravi Granthi Rogas. So disorders related to the blood and cardiovascular system and disorders of the endocrine system. So we'll see what are the important LAQ questions on this. So important LAQ questions are the Pandu and Kamala are commonly asked questions related to the Pandu and Kamala. That is the describe the etiology, clinical features, and classification and diagnosis and management of the anemia and Kamala. Whenever they ask related to the Rasa Rakta is Kamala, if they ask, you have to write the pediatric related Kamala. You should not write a Navajata Shishu Kamala, that is the jaundice, neonatal jaundice, you should not write. So whenever they ask Kamala, you have to write this Kamala, okay? Kamala related in the hepatitis related, okay? Pre-hepatic conditions, hepatic conditions, and hemolytic related the jaundice you need to write, not the so, Bhaupitta Kamala and Alpapitta Kamala. That is the those things you have to write in this questions. Okay, if they ask specifically related to the Navajata Shish Kamala, then you have to write neonatal jaundice. You should not write here. If they ask only Kamala, you have to highlight mainly on this Kamala common causes of jaundice in children. We need to write, and Pandu in that you have to highlight is the Murdbhakshana Janna Pandu. You have to write, and what is its classification, types of anemia, and how you have to treat anemia and all. You have to write. Next is the hypothyroidism. They may ask our type 1 diabetes mellitus. They will ask common LAQ questions they may ask on this topic, or two SAQ questions also they may ask related to the Pandu, Kamala, or hypothyroidism they may ask. So next is the Mutravaha Sroto Rogas, that is the genitourinary system. In that, allotted marks for this topic is the 5 marks. So 5 marks is allotted for this topic, Mutravaha Sroto Rogas and Sandhi Rogas, rheumatical disorders and all. So very favorite questions in this is the only one SAQ questions will ask. MCQ questions will not come on this topic. So main very important thing is the diagnose and plan the chikitsa of Mutra Krucha in children. That is the compare this Mutra Krucha in children is compared it with a urinary tract infection in children. So in detail explanation is explained in the Kashyap Samhita about the Mutra Krucha. So there is a more chances of asking questions. That is the Mutra Krucha is there in this syllabus topic. MCQ questions, sorry, SAQ questions they may ask in this topic. And one more important thing is the nephrotic syndrome. So previous question paper also they have asked many a times this nephrotic syndrome. There is a chances. So commonly they will ask is the Mutrava Srotas. So they may not ask related to the Kamavata and all. They won't ask because it's not common with the children. So they will, I think, as per my knowledge, they will ask SAQ questions on this UTI, Mutrakucha, or nephrotic syndrome. They may ask. So this is a favorite thing they may ask. And Mutrakucha symptoms, which is explained in the Kashyapa Samhita Vedanadhyaya, it is clinical features are explained. That you should also mention with if they ask about the Mutrakucha, that is the Romarsha, Angarsha, Mutrakale Cha Vedana is a very important thing. And Dashat Ostaha, it bites the lips while voiding the urine and all because of pain. So those things you have to eyelid and they bastim sprishate. There will be frequently the child will touch the hypogastric region that the bladder near the bladder and all they will touch. And in detail explanation is also explained in the not only in the Vedana Adhyaya. Mutra Kucha detailed explanation is also explained in the Chikitsa, um, the Chikitsa part of the Kashyapa Samhita. In that, Vataja, there are different types are explained. Vataja type of Mutra Kucha, Pittaja, and Kafaja, Raktaja, Sannipataja, and Dandvaja are explained in the types of Mutra Kucha and treatment are explained. So common drugs used in this Mutra Kucha are the Gokshura, Punarnava, Shatavari, Amalaki, Truda Panchamula Kvata, and the Aritakhyadi Yoga. And common formulations used in this is the Niri, Chandrapapavati, Varanadi Kvata, and Shatavari, Kshirapaka, and all. They may give, these are the commonly used drugs in this Mutra Kucha. So one more important syllabus with the questions is the nephrotic syndrome. You have to see the what are the cardinal features, what are the types of nephrotic syndrome you have to write here. That is the massive proteinuria, hypoalbuminemia, and edema and hyperlipidemia are the classical feature of this nephrotic syndrome. And nephritic syndrome also, there is a difference is given in this. So hematuria is the very common with respect to nephritic syndrome. So you have to see this topic, and what is the common line of treatment are explained in this nephrotic syndrome. So usually a steroid is given as per modern concept, that prednisolone is given to 2 mg per kg for 6 weeks, then 1.5 mg per kg. Alternative days for 6 weeks they will give. So just go through those topic. So next is there are three syllabus points are there: Twak Roga, Sthirasnayu Rogas, and Unmada Rogas. In these three topics, 13 marks are allotted for this syllabus topic. In this, they may ask MCQs, they may ask SAQ, they may ask LAQ. So, if they ask LAQ in this topic, 3 MCQs will come, or if they ask two, yeah, two SAQ may ask, or three MCQ may ask in this syllabus topic. So we'll see the what are the commonly asked questions on this topic is the LAQ questions. The Twakroga, Sirasnayu, and Unmada Rogas in these topics, they may ask diagnose and plan the Chikitsa related to the Visarpa and Charmadala, and describe the etiology, clinical features, complications, and management of scabies and eczema related to the Twak Roga they may ask. And in the Sirasnayu Roga, commonly asked question is the explain Nidana, Lakshana, and Chikitsa of Jalasirshaka. So Jalasirshaka is every alternative years they used to ask this question. Jalasirshaka is one of the favorite topic they will ask in this. And cerebral palsy is also very important questions they may ask is the either Jalasirshaka in that they may ask, or one more topic is the cerebral palsy they may ask related to the Sirasnayu. And Unmada related, that is the neurobehavioral disorders. In that very commonly asked questions in this is the autism and ADHD they may ask. So you should go through this. And Shayamutra is also one more topic they will ask related to the Unmada Rogas syllabus topic. So if you read all these topics, definitely the 10 marks will come on these topics. So just carefully you have to read and write it in the exam. So Charmadala in this there is some explanation is there in this slide related to the Charmadala. It is explained in the Kashyap Samhita is explained. It is commonly compared with the eczema. And what is the clinic? The definition of the what are the clinical features is the Kando, Rukshata, and Commonly this dryness will be more in this, severe itching will be there, and red patches will be there, cracks on the skin will be there in this condition. So you have to see this lakshanas and Ayurvedic management also. You need to write externally what it is given, and internally what should be given. The internally the Panchatikta Gurta can be given, or Gudichi preparations can be given, and Kadirarishta can be given depending upon the age. You have to give these internal medications, and external medications like Eshtimadu or Panchatikta Gruta application can be given, or Nalpamaradi Taila can be given. So like this, these external applications also given in this Charmadala topic. So in detail, we need to write if they ask for the um, exams. So what are the signs of autism? You all know this signs of autism. So there will be a repetitive behavior is a very, very important thing in this, and avoiding the eye contact. So eye contact, and child will be usually, it will be more of kapha will be there. Child is not involving with the other children. Restrictive behaviors will be there in this. So in this slide, it is a important signs related to the autism are there in this. Just go through this slide. That is the it prefers to be alone. Okay, restricted behaviors will be there with the child of autism and all. So autism spectrum disorders treatment in children is the it is a mainly vata imbalance will be affecting the manahava srotas, and majjava srotas will be there, and impairment related to the speech, social interaction, and cognition will be there in this, and common treatment principles are the Medhya Rasayana, vata shamana drug should be given and all. So along with that, some of the medications also mentioned in this slide. So just go through this topic, and very, very important. Along with this, you have to, along with these medications, you have to go for the occupational therapy, speech therapy, and behavioral therapy is also very, very important. And some of the panchakarma procedures like abhyanga, shiro shirodhara, nasya, or matra basti are mainstay of treatment in this autism. So, and one more behavioral disorder is the very common nowadays. That is the ADHD symptoms in kid. Okay, there are as per DSM-5. So, inattention, hyperactivity, and impulsiveness are the three main clinical features will be there. Okay, inattentions, in that forgetfulness will be there, or easily distracted will be there, and hyperactive. Child will be it will be making unnecessary movements and all while sitting and all. Child will not sit quiet and talks non-stop without any break. Baby will be continuously, it will be talking related to the hyperactivity, and impulsiveness also it will be there. So child, whenever others will be talking, child will interrupt others, and takes risk, and can't wait for the turn and all are the common features will be there. And mainly vata predominance with respect to Ayurveda. In this vata predominance is very much will be there, with the disturbance of rajas and tamaguna will be there, and mainly impairment will be there in the D, Dhriti, and Smriti will be there. So treatment principles are there in this. So Vata Shamana, Medhya, and Rasayana, and Sattva Jaya Chikitsa are behavioral therapy are also very, very important with respect to ADHD. So commonly used drugs are Medhya drugs, that is the Brahmi Gruta, Kalyanaka Gruta, Saraswatarishta, Brahmi Vati, and all you should give in these along with the some of supportive measures. We have to give these drugs for treatment. So in examination, you have to write in detail about this topic if they ask. So next is the last syllabus point, that last four syllabus point, that is the Attyaika Chikitsa, Attyaika Roga, Emergency Pediatrics, Bala Panchakarma, Kishora Swastha, and Anya Rogas. So first two, 19 and 20, that is the Bala Panchakarma and Attyaika Chikitsa. Mainly they will ask two questions on this. One is from the Attyaika Chikitsa SAQ questions they may ask, or LAQ also they may ask, but in this commonly they will ask SAQ questions related to these topics. So Attyaika Chikitsa, commonly in this the pediatric emergency, commonly asked questions and all we'll discuss, and Balak Panchakarma. Other two, these are MCQ only. They may ask MCQ questions on this. They won't ask because these are not included under SAQ questions. So Kishoro Sasta and Anya Rogas are not included under the SAQ questions. Only MCQ questions will draw from this topic. So mainly you have to concentrate on Atyeka Chikitsa and Bala Panchakarma treatment related. So SAQ questions on Atyeka Chikitsa, commonly asked questions is the define status epilepticus and describe the symptoms and management of status epilepticus they may ask. Or foreign body in the respiratory tract is also commonly asked in the previous question papers. And another the in the related to the Panchakarma, they may ask enlist the types and methods of Svedana in children and explain the indications, contraindications, and methods of Pinda Sveda, Nadi Sveda, Upanaha Sveda, they may ask. Or they may ask the explain the indications, contraindications, and selection of medicines with respect to Virechana, Nasya, or Vamana, they may ask related to this topic. So LAQ questions, very rarely they may ask. If they ask, there is a chances of Atteke Chikitsa related to this, describe the symptoms and management of acute breathlessness, cardiorespiratory arrest, and foreign body and respiratory. In the structured questions, they may ask like this, or enlist the types and methods of Svedana, all those things they may ask. Omana Nasa, explain the indications, contraindications, and selection of medicine with respect to Virechana, Omana, and Nasya procedures they may ask. So these are the some of the important points related to the Panchakarma, that is the Abhyantara Snehana. The usually in the Kshirapa Avastha, we cannot give the Snehana in the Kshirapa Avastha. So Gruta can be given in the Kshirannada and Annada Avastha, we can give the Abhyantara Snehana is indicated. So Gruta, if we give the Gruta, it will increase the Varna Bala of the child and Ayurveda. It is explained in the Kashyap Samhita. It is also Brahmana in nature. And Taila, the usually the Katataila is explained related to the Krimi-Kosta. The Taila is explained, Katataila is explained in the Krimi-Kosta. That is the, while explaining about the Krimi Chikista, they have explained the Taila, Abhyantara Sneha is explained for Katataila is explained for this. So what is the matra should be given? They have matra should be always alpa matra should be given for the children. That is the Kaniyashi Shat. So alpa matram baleshu ruddeshu cha Kaniyashi we have to give in a small quantity we have to give. And pravicharana sneha should be given. Always pravicharana sneha mixed with the other food and all we have to give for the children. In the Kshirapa Avastha, child will be already, it will be more of Sneha because continuously baby will be on the milk itself. You should not give a Snehana in the Kshirapa Avastha. It is contraindicated. And Shvedana, so there are, you all know that Asta with the Sveda explained by the Kashyapacharya. That is the Asta Sveda is explained up to 4 months and Padasveda for more than 6 years child. Padasveda is explained and mainly this will going to treat the Vata Kapha Pradhana Vyadis. It is indicated in the Kashyap Samhita. Siddhisthana, they are explained for the mainly Kapha Vata Pradhana diseases, it is explained, and Mudhushveda should be given for the children. So keep the while giving Swedan and all, child will be not cooperative and all. We have to give some of the mother drugs or something for the eating for children and all. We have to give that things modifications we have to do with the children. So with respect to Vamana and all, they have explained in the different context. In the Kshirada Avastha, they have explained applying over the breast, the drugs which are Vamana Upaga drugs, that is the Apamarga Churna plus Saindava Churna plus Madhu is applied over the breast in the Kshirada Avastha. When it dries, you have to wash it and feed the baby for the Vamana Upaga. So whenever it is needed, so we have to give a Vamana in this age. And one more is the Kshirannada Avastha. Vamana drugs, that is Vacha plus Madhu should be given with the Stanya is a you have to give for Vamana purpose. And in Annada Avastha, we can give a pay of Madanaphala, Vacha and Saindava with the Sarshapa and Gruta can be given. So some modification related to Vamana are the Sadhya Vamana with Mrudu Vamaka drug should be given, and Kalka Kwata, it should be mixed with a Sarkara or a Madhu. It will be palatability is very, very important with respect to children. That's what we have to give with this drug should be given. Vamanupaka drugs or woman drugs should be given along with the Madhu and Sarkara. And while inducing Vamana and all, we have to Kamala Nala is explained in Ayurveda and in the Kashyapa Samhita, or in the Sutras, in the Sushra Samhita also it is explained Kamana Nala, or we have to induce with the mother's finger, we have to induce the Vamana. These are the some modifications are explained with respect to Vamana, and Vegas with Vamana are the so Vega in the Kashyapa Samhita, the Pravara Vega is the 6 to 7, Madhyama Vega is the 4 to 5, and Avara Vega is the 2 to 3. Vegas are considered as a Madhyama, Pravara, and Avara Vegas are explained in the Kashyapa Samhita. And what are the indications for Vamana in the children are the Kshiralasaka, Yavana Pidaka, and any of the Stanya Dushtis if it is there. In those conditions, we will be giving a Vamana. So Virechana. Murdu Virechana should be given in the what age group is the commonly if you see the Pakka Chikitsa Adhyaya while explaining Pakka, the 1 year of the age in that age group he has mentioned the Virechana should be given for the child of 1 year. So commonly used drugs is the Aragvada, that is the it is a Mrudu Virechaka, that's what is Aragvada, or we can also choose Trivrut Leha also, that is also the Sukha Virechaka drug can be given, commonly indicated in the Vibandha, Daha, Vidavarta in conditions, we can give this drug. And slight modifications, what we can do in this is the so along with you should be Ruchikara and Manapriya. So child should like while eating and all while giving this Virechana drug. We have to give a some Madhura Dravyas like Guda and all along with giving Virechana drugs we can give for the child. And Shuddhi, there is Pravara Shuddhi is 4, Madhyama Shuddhi is 3, and Hina Shuddhi is the 2 are in this Virechana. And Basti is always considered as a best with respect to children, and children who are contraindicated for the Virechana. So there we have to give this Basti. So Astapana Basti can be given whenever if there is any contraindication related to the Virechana is there, we have to give this drug. And it's a Bala and Angavardhana, and it is having multiple indications with respect to children. So there is no much complication with Basti. They have explained in this with respect to Basti and all. This is the dosage of the Niro Avasti dosage and all explained as per the age classification. They have explained. So just go through this, and Matra Basti, this dose is also explained. That is the Rusva Matra, Madhyama Matra, and Uttama Matra. They are explained for the children in the Kashyap Samhita. Just go through this. So next is the Nashya, Pratimarsha Nashya is explained for the children in case of the Marshanasya is very difficult. That's what you have to, we can do the Pratimarshanasya with respect to children. So on the Dhatri itself, we can give this Pratimarshanasya, and Katutaila is indicated in case of this Krimi Rogas, Katutaila is indicated for the children, and Anutaila is explained in case of any of the diseases related to the nose and respiratory tract infection. To prevent the allergic conditions and all, we can go for the Anutaila. So this is about the total overall syllabus point. I think it became very too lengthy, I feel, because I want to cover in detail. That's what I tried to cover. If you have any doubts, you can ask.
Hello, sir.
Okay. Yes, sir. Yes, sir.
So much, sir, for your very good explanation, sir, for your students. Students, you have any doubt, you can ask now.
If you have any doubts, you can ask. And
You can unmute and ask others. You can put in chat.
any doubts? Yeah, how you felt, whether it is become very lengthy, bore, or anything, how you felt? I think
No, sir.
I
No, sir. It's needed because you have explained each and every topic
so
on what want to study, what should not, or how to study everything. It's very nice, sir. So one question is there. In case of referral criteria for the disease, what are the points to be written, sir, and what should be covered in such questions?
mainly if they ask some questions, they may draw from the medicinal medicine related, and some questions they may ask from the referral criteria. So if you see with respect to, for example, if you take the respiratory disorders, so in the respiratory disorders, in this topic, whenever there is any of the severe respiratory distress is there, if you asthma, if exacerbating asthma is there, or severe respiratory distress is there, either it may be tachypnea, severe chest in drawing, and SpO2 is coming. Means it is if it is a severe condition, in such conditions we need to refer. If it is a severe with respect to the annavasrotas, that is the if severe dehydration is there, so there we can't go for the oral medications, we can't treat. So we have to go for the IV fluids only we need to give, because we immediately dehydration is one of the very common condition for the cause for the childhood mortality in the under five age group. This is a very important cause for under five mortality rate. So in those conditions, in severe conditions and all, if such conditions are with respect to which topic they have asked, according to that you have to write. Okay, if you if they ask about the Annavasrotas, Atisara and all, severe dehydration is there, hypotension is there. In such conditions, we have to refer and all. We have to write the what are the complications and how to treat in those conditions. We have to write with respect to referral criteria. Yes.
And second question, sir, do we have to write dosage in the management?
Yes, definitely. If you know doses, as per the we can write doses. If it is, if you know, you have to write. If you write a dosage and all, it will be better. If you don't know and all, at least you write a what are the important things are there. You have to write. Means if you don't know, you have to write what are the important drugs mentioned with respect to those topic. You have to write.
Another question. Uh, Sir, we feel difficult to remember the preparations for different diseases, not only in comorbid in all subjects. When they mention the Gluta preparation with some drugs like that, formulation we unable to remember or how to remember those or whether to remember all the. I think the question is whether to remember all the ingredients or you want to write only important ingredients in the exam.
So if you see Yoshadivati, if you see Yoshadivati, the what is the important thing in that you have to write. So we can't write all the ingredients. So you have to write at least what is the important formulation is there. Cricket is a very important in the Yoshadivati. Like that, in the particular drug, what is the main drug is there? You have to highlight that, and remaining are not important. At least you have to write the what are the important ingredients are there, that we have to write. There is no need to write all the things, but if you know some at least two to three, you have to write what are the important things are there. You have to write. And the formulations with respect to diseases and all, it is a see, if you see the Kasa Swasa and all, it is a, if you most of the drugs are same. Sitapaladi Churna is also used in the adult, and it is also used in the pediatric age group. Talisadi Churna is the same thing. Talisadi Churna is also used, and Dashamuladi Kashai is also used in both the age group. But here you have to make a difference. Is the main thing is the drug means dosage. So you have to reduce the dose as per the age, and you have to give. Mainly doses will be different. So most of the things are very common with the respect to children, adult and children are common. but drug dosage and all, it will be different. That you have to write, you have to highlight that point. Okay. Mainly dosage and all, you have to in the small quantity you should write.
And then, sir, what about the concept of Swarna Prashana?
So Swarna Prashana is a very, very important topic that they may ask some of the questions on this. So Swarna Prashana, you have to write what is explained in the Kashyap Samhita. You have to highlight that. What is the method of preparation is there? What is the chikitsa means? What is the importance of that? There is benefit of this, that we have to write related to the Swarna Prashana. That is also very, very important topic. They may ask, Swarna Prashana is also commonly, they may ask the questions. So you have to write the method of preparation and what are the benefits related to the Masat Paramamedhavi, Vyadirvi Nachadrishyate and all, Shadbi Masa Shrutadaraha. All those all those important things are there. That things you have to write. Aisham Mangalam Punyam Vishyam Varinam Grahapam. So those things we have to write with respect to Swarna Prashana. That they may ask questions on this Swarna Prashana or Lehana also. They may ask what are the indications of Lehana, contraindications Lehana. In the Vedic Shamatva topic, Bala Ruddhikara Bhavas. So in those topics, they will ask these things.
Another question, sir.
Yes.
What about Vedanadhyaya topic?
So Vedana Adhyaya topic, there is no, there is a, in the while classification, there are two topics are enclosed in this. There are two things are there. So Samanya Chikitsa Siddhanta, they may ask Vedana Adhyaya, and one more topic is the Chikitsa Siddhanta, ಅಥವಾ Matra drug doses are the 3 points combined with the Vedana Adhyaya. So there is a very rarely they may ask SAQ questions or LAQ questions on this topic, because there are many diseases, are around 36 diseases are explained in those things. So all and soul they may ask, may not ask, or sometimes they may ask questions like what is the importance of Vedana Adhyaya, and write some of the clinical features of some Shirashula. What are the clinical features of Shirashula, or what are the clinical features of Atisara explained in the Vedanadhyaya? They may ask questions on this. So commonly asked questions is the Samanya Chikitsa Siddhanta, and MCQ questions they may ask led to the matra of the drugs and all, different drugs matra and all MCQ questions they may ask. Even they may draw some SAQ questions on this topic also. I can't say it, if they won't ask. There may be a chances of asking questions on this Vedana Adhyaya. Direct, what is the importance of Vedana Adhyaya, and what are the some diseases they will ask question clinical features of some of the diseases they may ask. Yes. Next.
Dr. Alka Sharma, if you want to ask, you can unmute and you can ask questions. Do you have any questions other than that? Because you raised your hand, because that's it. You can unmute yourself, you can ask. And then same question for Dr. Alka Sharma is there for, sir, for the treatment, both Ayurveda and modern medicine we will have to mention.
See, if they ask LAQ questions, so specifically they will ask some of the questions will be on Ayurvedic topic if it is there. Or that you have to write first Ayurveda. Okay, they will not ask only in detail about the management and all. So structured questions will be there with respect to diseases. So etiology, clinical features, and management of diagnosis and management of the conditions they may ask particular with respect to diseases. So you can write first you have to write Ayurvedic topic if it is there. Okay, nephrotic syndrome there you have to write if they ask related to these topic nephrotic syndrome and all. So there we have to highlight mainly modern thing. Then you have to write the Ayurvedic aspect. So if there is any detailed explanation, if it is not there, you can't write the Ayurvedic part. So wherever the relevant questions, according to the relevant questions, if you know Ayurveda, you write it first. Then you have to write the modern. In concise way, we have to write because there will be structured questions will be there. You should not write lengthy explanation of modern and Ayurvedic management. So you have to concisely you have to write. Okay, but it depends upon the what questions you are attending. Okay, if they ask neonatal jaundice treatment, you have to write modern itself. Okay, there is no explanation related to the Ayurveda with the Navajata Kamala. So like that, if modern question is there mainly, you have to write phototherapy. If you Navajata Shisu Kamala, if you are writing phototherapy, okay, and fluid and feeding and all, whatever treatments are there, that we have to write. So like that, you have to see the question, what it is asked, and according to that, we have to write.
Thank you, sir. Another question, sir.
Yes.
Whether you want to write Kaya Chikitsa shlokas in the Samprapti
Yes, you can write, no issue. Swasa and all, you can write Samprapti. Okay, it won't change. You can write Samprapti related, Kaya Chikitsa, Samprapti and all. It will be same. You can write. There is no any issue with the Samprapti.
Thank you, sir. Another question. You want to in a importance Kasha Samhita and his contribution is asked repeated many times in PYQ. Sir, what about that?
No, there is no in our now syllabus topic. In this syllabus topic, there is no contribution of Kashyap Samhita and all. In the syllabus itself, it is that is removed. So in the it is not there in the syllabus topic. This contribution of Kashyap Samhita and all, it is not there. So they won't ask questions on this contribution and all because only this is a first syllabus point that will come under this. They have mentioned only one MCQ question they will ask in this contribution of Kashyap Samhita and all. They won't ask questions nowadays. Okay, as per this syllabus guidelines, they won't ask.
Oh, thank you, sir. And yeah, we will provide your recording at last of the all the sessions. Don't worry, Dr. Bhumike will provide the recordings, so that you will get the PPT. And then any questions? So Nidana Panchaka mentioned in each questions like you or not.
Yes.
Nidana Panchaka mentioned each questions are like LAQ or not.
Nidana Panchakas.
Yes. Yeah, Nidana Panchaka in each questions like LAQ or not like that. I don't know what's the like if you explain LAQ is the best. Likely ask question, I think so.
I'm not understanding questions. Actually,
Sir,
Nidana Panchakas.
Omkareshwar, can you unmute yourself? Can ask your question? I
So
think
LAQ questions in that
LAQ or
Nidana
not? That's
Panchakas.
the question. Nidana Panchaka mention in each questions like LAQ or not.
In the LAQ questions are Nidana Panchakas. If they ask diseases related, you have to write Nidana Panchakas. If they ask specifically, then you can write. So, as LAQ questions, there are six syllabus points are there in that LAQ questions. Navajata Shishu Paricharya, Stanya, Vijnana, and diseases related the Swasa Rogas, respiratory disorders, and Annavas Rotas. Already I have explained in detail. Rasarakta, Twakrogas, and Attaika Rogas. In those six syllabus points, they have explained the LAQ. If they specifically asked Nidana Panchakas related to those topics, then we can write.
Thank you, sir. Yes, sir, we will try because if you want to get ready in Google Meet, then we will provide the PPT as possible. Today or tomorrow, we will send the PPT in the group. Any other questions? Okay. And let's conclude. We are concluding the today's meeting. Thank you so much, sir, for giving a very, very explained orientation. each and every topic you have selected and given what are important, what should study for our students. I think they are very, very impressed and they are follow your advices. Thank you so much, sir,
Thank
for your
thank you.
giving valuable time
Thank
for
you.
us, sir.
Thank you so
From
much. And
Ayurreshmi and through our students, I am thanking you, sir. Thank you so much. We need
thank
your
you so
support in
much.
future also.
Thank you so much, Dr. Krishna Raga, the founder of Ayurreshmi, for giving me this opportunity to present this exam orientation class for our students. Thank you so much. Thank you, one and all, for patient listening. Thank you.
Thank you, sir.